All right, on this slide today, we're going to talk about our hip adductors. So let's go and use our 3D application here, and let's jump into our adductors. All right, we got our adductors on this side of the screen. Once again, all the musculature that were kind of outside of the area that we're looking at for this slide and this side of the body has been hidden. It gives us availability to kind of jump around and be able to see in more detail the area that we're looking at. All right. Hip adductors are a lot of over time overlooked in lower back pain or in pain in general. So let's look at how the adductors are coming up and attaching on the pubis bone. That's right here. I'll go ahead and highlight it so you can see it. So there's our pubis bone. How it also transitions around to the ischium. All right. So that musculature, even though they're different muscles, our adductor group are all coming up and converging into that region on the pelvis. All right, we can also see that the musculature is coming down and attaching on the posterior aspect of the femur, all right, which could also aid in, if you looked at it from an action standpoint, lateral rotation, if you looked at your line of pull that we talked about earlier in this lesson. All right, with that in mind, imagine if you had this is a male model. So let's imagine that this model, we're animatable. Unfortunately, this version is not. But imagine if you had a young child on one of the hips, let's say on the right hip here. When you have a child on your hip, that side elevates to support that child, right? So imagine if this right hip, and use my mouse here on the screen so it's easier to see. Imagine if this right hip were elevated, all right, so all the weight distribution will fall onto this left leg. These adductor muscles on the side with a high hip are going to be shortened as the femur comes in. I hope that makes sense. It's kind of hard to understand, but nonetheless, if you have someone has a high hip on one side or another, always check their adductors because they could be shortened and bringing the pubis bone or the femur closer together and can be a very overlooked problem area for someone with lower back pain. All right. Also, with our adductors, they change roles. We know about reverse actions from massage school. With our adductors, they change during the gait walk cycle for the phases that you would go through. So in one instance, they may be doing extension or they may be doing flexion based off of positioning of the femur. All right. So something to think about with someone who may walk a lot or they're having lower back pain, always check the adductors because they can be very problematic. If you want to know the names of them, we can look at them and say this is the pectineus, this is the adductor longus, this is the adductor magnus, which is the big one, right? We've also got the adductor brevis, we have the adductor minus or minimi, and the gracilis. And those are all hidden out, but that's where they reside and definitely can change the way the pelvic is setting. Big reason because of the pubis symphysis right here. We do know that all of the pelvic region is really two different sections of bones, if you will, that can articulate independently of one another. And that's why that pubis symphysis is the dividing point for the left or the right side on the anterior aspect. All right, but nonetheless, that is our adductors for this slide. Thank you.